the WHO website live stream. Should participants on the Zoom wish to communicate with the Secretariat, you may kindly do so through the chat function. I shall now like to give the floor to the Director General, Dr. Tedros, to lead us through our high-level segment of the meeting. Dr. Tedros, please, you have the floor.
Thank you, Jude. Excellencies, honorable ministers, distinguished guests, dear colleagues and friends, good morning, good afternoon, and good evening. Together with the President of the European Commission, Her Excellency Dr. Ursula von der Leyen, it's my great honor to welcome you to this first meeting of the Facilitation Council of the Access to COVID-19 Tools Accelerator, the ACT Accelerator. I would now like to give the floor to President von der Leyen for her opening statement. But before I do, I would first like to highlight the invaluable role she and the European Commission have played during the startup phase of the ACT Accelerator. I was honored to co-launch the ACT Accelerator with you in April, with a shared vision of equitable access to essential tools to combat COVID-19. The European Commission's efforts under your leadership have been very critical in moving forward this agenda. Thank you for your leadership and continued support for this common cause and your inspiring demonstration of global solidarity. President von der Leyen, you have the floor.
Thank you very much, Dr. Tedros. And we couldn't have done it without a good team, without you and all the friends who supported us. So thanks again, Excellencies, colleagues, friends, and partners, indeed from across the world. Thank you for having accepted Dr. Tedros and my invitation to join the ACT Accelerator Facilitation Council and to participate in its launch meeting today. We have an important task ahead of us: to empower and resource all health forces across the world, to work together for the speedy development and deployment of new solutions to manage and overcome the COVID-19 pandemic. We need new solutions for prevention, testing, and treatment of COVID-19. We all know we need them fast. We need them for all those in need, anywhere. And we need them on affordable conditions. And this is the mission and the spirit of the ACT Accelerator. And that is why the ACT Accelerator was set up only 4 months ago. We will learn today from Dr. Ngozi and Sir Witty the progress already made. I must say I'm so impressed by what has already been done in just 4 months' time. And let me therefore say thank you to all the persons and all the organizations involved in delivering on the ACT Accelerator's goals. The co-conveners in the different pillars, the delivery partners, the industry, both large and small, many foundations, and many more. My thanks notably go to the World Health Organization and to you, Dr. Tedros, the Director General, for the excellent cooperation and drive in taking forward the ACT Accelerator. And indeed, we have seen a tiny virus threaten our health and wreaking havoc to our global economy and to our way of living and working. We have seen that the virus does not respect borders or conventions. We are all affected. Globally, up to 95% of the population is still at risk. And developing countries are particularly vulnerable. 100 million people could slip below the poverty line. But also industrialized countries are not safe. Resurgences of the virus are taking place in many countries. And if we wanted an experience of what it means that no one is safe until everyone is safe, there's probably no tougher lesson to be learned as from this pandemic. We are in it all together. and we will only get out of it all together. Our joint response to coronavirus pandemic shows that the world can rise to the challenge together. Our scientists are sharing data as never before. Our research funders are coordinating priorities and best practices across the globe. Our regulators are speeding up procedures for approving medicines and exchanging information. Our companies are taking risks in scaling up development and manufacturing for global supply. Global health organizations, networks, and foundations are joining forces. Countries are pledging resources and committing to universal and fair access to tests, treatments, and vaccines. I would like to warmly and profoundly thank all world leaders who have committed support and resources at the pledging event that we organized together on the 4th of May and on the 27th of June. You made it possible for the ACT Accelerator to take off and to be the unique and unprecedented global cooperation that it has become in such a short period. It is now our task to reinforce this momentum, to facilitate the ACT Accelerator's work, and to show to the partners involved that they deserve our support. Through the ACT Accelerator, the world can and will invest in common solutions and common goals, common goods that will save lives and ensure safety for all of us. Well, it is difficult to find a more compelling investment case. The European Commission will remain deeply and entirely committed to the success of the ACT Accelerator. Stella Kyriakides, our Health Commissioner, will represent the European Commission in the Facilitation Council with my full support and that of our fellow commissioners. And I am so grateful to South Africa and Norway for having accepted to co-chair the ACT Accelerator Facilitation Council. Thank you very much, Cyril, and thank you very much, Erna, for your commitment and for your leadership. Together with that of the many other leaders in this Facilitation Council, you will make the ACT Accelerator even more a success. The world needs it. We all need it. And with that, I want to hand back the floor to you, Dr. Tedros, my friend.
Thank you so much. Vielen Dank, my sister Ursula. I would now like to welcome the United Nations Secretary General, Antonio Guterres. Mr. Secretary General, the pandemic has demonstrated why, more than ever, the world needs the United Nations. Faced with a common threat, we need a common response. WHO has played a leading role, but because the pandemic is so much more than a health crisis, it has demonstrated the full attention of the entire UN system. Thank you for your leadership in harnessing the power of the UN in support of the overall coordination of the international response through WHO. Through the UN Crisis Management Team, the Supply Chain Task Force, the Global Humanitarian Response Plan, and more. Thank you for your leadership. And Mr. Secretary General, you have the floor.
Dr. Tedros, Excellencies, ladies and gentlemen, dear friends, the COVID-19 pandemic continues its surge around the world. The #1 global security threat in our world today is the virus. It is our common enemy. Yet we still continue to struggle to collectively make all the decisions and devote all the resources we need to defeat it. But it's not too late. We must start immediately by massively expanding new and existing tools that can rapidly respond to the new cases and provide vital treatment to suppress transmission and save lives, especially over the next 12 months. I know many pin their hopes on a vaccine, but let's be clear, there is no panacea in a pandemic. A vaccine alone cannot solve this crisis, certainly not in the near term. But starting now, a vaccine must be seen as a global public good, available and affordable for all, because COVID-19 respects no borders. And we must fully support efforts designed to speed up the development and availability of new COVID-19 diagnostics, therapeutics, and vaccines, and ensure equitable global access and allocation. We have just such a mechanism in the Access to COVID-19 Tools Accelerator, or ACT Accelerator, a groundbreaking collaboration that has gathered the World Health Organization and a remarkable group of the key international actors. When I joined the launch of the ACT Accelerator 4 months ago, we presented a vision to ensure that the world will emerge from this crisis together, where the formidable capacities of the world's leading global health agencies will be deployed in the battle against COVID-19. And today we have a proof that this vision is feasible. During the startup phase, the ACT Accelerator core partners have worked tirelessly to demonstrate that this unique model of cooperation works. They have proven that game-changing rapid diagnostics are possible. They have started rolling out to all countries the only proven therapy for severe COVID-19 disease. They have built a broad dynamic vaccine portfolio and established a COVAX vaccines facility encompassing 170 countries. And through the work led by WHO, it has established an equitable allocation framework for the rollout of these tools. The ACT Accelerator is the global solution we are looking for. Now we need to make important political choices if the world is to reap its promise. First, we need a quantum leap in funding to increase the chances of a global solution to get the world moving, working, and prospering again. The $3 billion contributed today have been critical as a seed funding for the startup phase of the ACT Accelerator. But we now need 35 billion more to go from startup to scale up and impact. There is real urgency in these numbers. Without an infusion of $15 billion over the next 3 months, beginning immediately, we will lose the window of opportunity to further advance research, build stocks in parallel with licensing, start procuring and delivering the new diagnostics and therapeutics, and help countries prepare to optimize the new vaccines when they arrive. I call on this Facilitation Council to look closely at the progress to date and the strong economic case for the ACT Accelerator, and commit to addressing the financing and equitable distribution of what will initially be very scarce tools. And allow me to say something out of this prepared intervention. We will never find this money in traditional humanitarian and ODA budgets. Donors must go deep into the exceptional funds that they have approved to address the COVID in all its dimensions. Without this exceptional mobilization of resources, the amounts I mentioned will never be reached, and it is essential that they are reached. And we must also overcome, and this is linked to the possible lack of funding, the worrying trend of numerous parallel initiatives and nationally focused efforts that would only not be undermining an effective global response, it would be self-defeating. It is in the best interest of all countries to ensure equitable access to new vaccines. As it was already said, no one and no country will be safe until everybody will be safe. That is how we maximize our chances to stop this pandemic as rapidly as possible. Third, we need greater trust. For any vaccine to work, the majority of men, women, and children across the globe need to be willing to accept it. Yet mistrust in vaccines is on the rise around the world. We have seen alarming reports of large segments of the population in some countries indicating their reluctance or even refusal to take a COVID-19 vaccine. This is fueling vaccine hesitancy and igniting wild conspiracy theories. To address public concerns, the United Nations is addressing these as part of our verified initiative by delivering science-based information on the COVID-19 vaccines in human terms. Together with WHO, Gavi, the Global Fund, and other global health agencies, we will work with major social media platforms to halt deadly misinformation. And we will reach out to media partners, civil society, and other influencers to deliver content that builds confidence in the safety and effectiveness of a future COVID-19 vaccine. Dear friends, our global interconnectedness requires global solutions. Either we stand together or we will be doomed and fall apart. We need unity and solidarity like never before, and I thank you.
Thank you so much, my brother Secretary General. I know what time you woke up today to be with us, and thank you so much for your leadership, for your commitment to be with us and to finding a global solution to the COVID-19 crisis, and for adding your voice to the important launch to the next scale-up phase of the ACT Accelerator. Again, thank you so much for your leadership. It's now my honor to introduce Norway and South Africa as the co-chairs of the Facilitation Council. These two countries will be critical to leading and guiding the work of the Council and the ACT Accelerator. We're honored to have at this inaugural meeting His Excellency, the President of South Africa, Cyril Ramaphosa, and Her Excellency, the Prime Minister of Norway, Erna Solberg. I would like to invite each one of them to say a few words in acceptance of this important role that they have taken on with such energy. Starting with President Ramaphosa, your leadership, both at the chair of the African Union, as leader of one of the world's major market-shaping countries, has been hugely important in advocating for the ACT Accelerator. You have supported the vision and objectives of the ACT Accelerator since its launch and been a champion for the need to invest in health systems. Thank you for your commitment to champion the ACT Accelerator to ensure that in deploying these life-saving tools, no one is left behind. Your Excellency, President Ramaphosa, you have the floor.
Thank you, Dr. Tedros, and my sister Ursula, and your Excellencies, ministers. It's a privilege to address this inaugural meeting of the Facilitation Council of the ACT Accelerator. I do indeed accept the honor that has been bestowed on my country to co-chair the council alongside my friend and my sister, Prime Minister Solberg. The ACT Accelerator is a groundbreaking and innovating mechanism, a product of perhaps an unprecedented, ongoing and steadfast collaboration. Since it was set up, and it was a privilege to participate in the process of setting it up, it has achieved promising results and is now poised to deliver what I believe will be much more. The pandemic has indeed taken a heavy toll and continues to do so on all of us. It has led to the loss of lives, economic and social hardship, and insecurity throughout the world. We now have to speed up the process of finding tools to combat the pandemic. I'm sure we will all agree that faced with a pandemic such as COVID-19, it is essential that humanity should have a sense that if and when a vaccine is developed, all countries, including my own continent, Africa, should benefit and not be left behind. Humanity requires that a vaccine should be regarded as a public good to benefit all. We cannot achieve universal health coverage when the COVID-19 vaccine is available only to countries that are well-resourced in terms of research, manufacturing, distribution, and service. As long as someone in the world has the coronavirus, however remote they may be, we are all at risk from the resurgence of COVID-19. We therefore need to move swiftly to ensure that everyone has access to the vaccine once it's developed at the same time. Countries must together, acting in solidarity, support current global initiatives to fund COVID-19 vaccines. And this initiative is very important to achieve that goal. We should use all available infrastructure to conduct research to find safe and effective vaccines. The efforts by the WHO to enable collaboration among scientists to conduct clinical trials is very welcome. We all need to support these global efforts because they are likely to massify the availability of vaccines that are in the end appropriate for specific locations and populations. We must also not forget to incentivize vaccine development, especially for pharmaceutical companies. They may be concerned that if they embark on this very expensive process, it may not be profitable. As some have already done, governments may need to subsidize the development of vaccines as an incentive to ensure fast and adequate production. As a global community, we must encourage people to participate in safe clinical trials of different vaccines. The ACT accelerator is vital to achieve these goals. It offers us the requisite tools at the speed and the scale that is needed, but also an equitable mechanism to distribute them. Now that it is a proven functioning mechanism, we must waste no time in rallying support with the political and crucial the financial resources it needs to succeed. Now, as South Africa and on behalf of the African Union, we look forward to this cooperation and working with all states and partners to achieve our collective objectives. Of this, I'm sure that we will succeed. Thank you very much.
Thank you, President Ramaphosa. Thank you so much indeed. Moving now to our other co-chair, under Prime Minister Solberg's leadership, Norway has been one of the founding donors of the ACT Accelerator and has been crucial to its success so far. Prime Minister, you have supported the vision and objectives of the ACT Accelerator since its launch and are a champion for gender equality and women's health. Thank you also for Norway's vision and leadership in establishing and hosting the Coalition for Epidemic Preparedness Innovations, CEPI, which is now playing a vital role in supporting the development of vaccines. Your belief that together we can move mountains and combat this global health crisis in a united way has been a beacon for the world. And this spirit of togetherness and solidarity, I welcome you as co-chair, joining my sister Ursula, of this ACT Facilitation Council. Your Excellency, Prime Minister Solberg, you have the floor.
Thank you. Excellencies, partners, friends. Norway is honored to accept the invitation from the World Health Organization and the European Commission to co-chair the Access to COVID-19 Tools Accelerator Facilitation Council, or ACT-A Facilitation Council, as I've understood, will be easier to say. I'm delighted to be sharing this role with South Africa and my good colleague, President Ramaphosa. The impact of the global COVID-19 pandemic is devastating, and it's affecting countries unevenly. The work of the Council will be important to ensure a collective response to a collective problem. I pledge to continue our strong commitment to global solutions to this crisis and to advocate for the ACT Accelerator. The world needs resources, effective coordination, and instruments to tackle the pandemic. The ACT Accelerator will play a key role in a global, cross-sectoral coordination mechanism, and I'm proud to be able to contribute. The ACT Accelerator has already achieved impressive results. The The world has shown that it is able to come together at a time of crisis. But the challenge ahead is still formidable. The resource gap remains enormous. The pandemic is causing a vast range of problems, and it's dynamic. The needs of countries differs, and they will change over time. It may be important to find a impossible to find a uniform and fixed definition of what is a fair approach. Therefore, we must respond to the needs as they emerge, and we must do so together. Norway will work tirelessly to ensure that the common principles are established and followed, and that all countries and actors are listened to, so that we can maximize our results together. And we, as world leaders, need to sustain and strengthen our joint efforts. Through the ACT Accelerator, governments, organizations, industries, and civil society need to join forces as never before to speed up the development of vaccines, tests, and treatments. But just as important, we must ensure that the products of international science and industry are affordable and made available to those who need them the most, in line with the principle of leaving no one behind. As I've said before, this is a human rights issue, and it's a global health security issue. As co-chair of the Council, I will encourage these efforts and work to secure a transparent, accountable, and inclusive approach that also takes the gender perspective into account. The COVID-19 pandemic has highlighted the crucial importance of health to national welfare and economies and stability. We cannot afford to fail in our global efforts to beat this pandemic. These efforts will also be an important step towards ensuring better global preparedness and response to future pandemics. And no one is safe until everyone is safe. And we have no time to lose in the fight against COVID-19. And we must fight this fight together. It's in all of us' interest. And for the remainder of today's meeting, I'm a Minister of, Norway will be represented by my Minister of International Development, Dag Inge Ulstein. But I would like to thank you again for the confidence that you have shown in Norway, and I hope that we can also deliver on your expectations.
Tack ska du ha, Your Excellency.
Tack så
mycket. And we're delighted to have two strong co-chairs to lead the work of the ACT Accelerator Facilitation Council. We're also honored to have here with us today His Excellency President Kagame of Rwanda and also the chair of NEPAD to make opening remarks to inaugurate the first council meeting. Your Excellency, you too have supported the vision and objectives of the ACT Accelerator since its launch. And alongside President Ramaphosa, you have been at the forefront of leading Africa's response to COVID-19. You have previously said that we live in a time of unprecedented political opportunity to anchor the tremendous global public health gains of past generations in national health systems that are both sustainably financed and people-centered. That statement rings true now more than ever. Your Excellency, President Kagame, welcome, and you have the floor.
Excellencies, dear leaders, fellow council members, distinguished ladies and gentlemen, I would like to join you and emphasize the message of the leaders who spoke before me and the message of President Ramaphosa on behalf of Africa and the NEPAD on the importance of the access to COVID-19 tools accelerator for our continent. This is certainly one of the most important international initiatives underway in the world today and perhaps ever. I would like to commend the World Health Organization and the European Commission, along with each of the distinguished organizations supporting the various pillars. Each of the pillars is crucial, but the vaccine pillar holds the most promise for getting our economies and our citizens back to work. By pooling risk through this innovative model, we can ensure that vaccine distribution is fair and equitable. This will in turn support the resumption of economic activity, which benefits us all. We will also be able to ensure that vaccines and other tools are directed where they are needed most. Some countries are at greater risk than others, and some populations within countries require special attention. It is important to prioritize the hotspots. Allow me to conclude with a word from our experience in Rwanda and Africa in dealing with other health challenges. The difference between success and failure lies in building a robust public health infrastructure that can confront any health issue in a sustainable manner. Solid health systems combined with transformational partnerships such as this accelerator are absolutely critical. Rwanda is committed to partnering with the other council members and stakeholders to make this venture into the success that it needs to be. I thank you all.
Murakoze cyane, Your Excellency, President Kagame.
Thank you.
Excellencies, distinguished guests, dear colleagues and friends. The speed at which vaccines, diagnostics, and therapeutics have been developed for COVID-19 is nothing short of astonishing. It's a testament to the incredible advances in science and technology the world has made in recent years. We're now in the process of establishing a consensus on the international allocation of these products. But the ACT Accelerator will not be able to deliver on its goals without a significant increase in funding. As has been said by Secretary General Antonio Guterres, the $2.7 billion it has received to date has been generous and has enabled the robust startup phase. But this is less than 10% of the overall needs. At the same time, bilateral vaccine deals and vaccine nationalism could compromise equitable access and hold up progress for all countries in bringing the COVID-19 pandemic to an end. In the face of these challenges, the case for a united global effort is even stronger than when the ACT Accelerator was launched. Between now and the end of the year, we have a limited window of opportunity to scale up the ACT Accelerator and fully enable the equitable allocation framework. Currently, the ACT Accelerator is supporting research into promising vaccines, therapeutics, and diagnostics. But we need to rapidly scale up our clinical trials, manufacturing, licensing, and regulation capacity so that these products can get to people and start saving lives. The Facilitation Council is critical to ensuring global leadership and advocacy for the ACT Accelerator. We're relying on you to provide high-level advice for implementing the pillars of the ACT Accelerator and for guiding us toward these fruitful interactions with our principals and partners. We face a monumental challenge. Your political leadership is critical in the months ahead. I thank you once again for joining this council. With that, I would like to thank those of you listening in online and hand over to the ministerial co-chairs, the Minister of Health of South Africa, Dr. Zweli Mkhize, and the Minister of International Development of Norway, Mr. Dag Inge Ulstein, to lead us through the remainder of the ministerial segment of the meeting. Jude, back to you.
Thank you very much, Director General and Your Excellencies. As indicated earlier, we would now end the live streaming of this meeting as we move into the second part, which is the ministerial segment. And I do have the pleasure to recognize the two co-chairs for this ministerial segment, the Honorable Ministers for South Africa and Norway, Dr. Zweli Mkhize and Dr. Dag Osten. May I now kindly give the floor to Dr. Mkhize to lead us through this particular agenda.
Thank you very much, Jude. Excellencies, the heads of states and governments, the Director General, Dr. Tedros, my brother, and you, whole UN family. Thank you for leadership and the guidance. And our co-host, Norway, thank you very much for the partnership. My colleagues and co-host, Minister Ulstein, members, you have all seen the terms of reference of our council, which have been developed in consultation through several channels. In